This exercise is one of my favorites for increasing thoracic rotation through the mid-back here. So patients who are complaining of stiff backs or inability to rotate during their activities, that this is an exercise that we'll often give if we do find that they do have a stiff back through the middle part of their spine. So what this looks like, it's a variation of a yoga pose, but you're going to use a foam roller because we feel that it gives just a slightly better stretch at the end portion of the motion. So you go on all fours, so knees and hands here. You're going to put the foam roller next to your knee and hand, and then the opposite hand's going to go on the foam roller with the back of the hand on top of the foam roller. Now from this position, think about a pole going through your body and you're trying to rotate around that pole. And the foam roller is going to help glide and put your body in a good position for this stretch. So what this will look like, put the back of the hand on the foam roller, you're going to reach and twist, hold it just for a couple seconds, and then bring it back. And then you're going to go into it again. Good. So you just go in and out, a nice slow tempo, maybe about a second or so hold at the end of that motion. And the idea is that we're stretching the tissues next to the spine and we're taking the rib joints and the spinal joints through a rotational movement to try to mobilize the joints a little bit better. So this will help increase some of that thoracic mobility if a patient is dealing with a real stiff mid-back. Now another variation of this is that you can, I'll show it on this side here, you can put the back of the hand on the foam roller, reach out, and bring it back in. And if you feel like you need to get a slightly different stretch to the mid-back and the straight-on version is just not hitting the muscles in the right spot or the tightest spot, then you can try playing with different angles, and that might hit different spots where you feel a little bit more tension. And then if you do find that it's a little more tense in one of these different angles, then you can just repeat it in that orientation. So you can play around for a little bit and try to get the most out of this exercise to increase your thoracic spine mobility.